Muy buenas tardes a todos, muchísimas gracias por acompañarnos en este café de música y ciencia. Tenemos una oportunidad maravillosa de compartir estas conversaciones con científicos, con líderes al frente de proyectos de investigación y con profesionales que están llevando a cabo proyectos totalmente innovadores para hacer frente a situaciones sociales y de salud pública que son en muchos casos críticas y en otros situaciones de emergencia o capitales en la salud pública de un país, incluso como ha marcado la Organización Mundial de la Salud, ¿no? Estas conversaciones van a versar sobre la salud maternal y el impacto que están viendo los investigadores que tiene la música, tanto para la prevención de posibles enfermedades o posibles sintomatologías, como para el tratamiento y el acompañamiento una vez que se han dado. El caso que tenemos aquí hoy, la conversación que vamos a tener con el Dr. James Reid, es muy inspirador, nos parece fascinante, puesto que es un estudio de investigación y una aplicación muy práctica de cómo llevar las artes y las humanidades a un contexto totalmente crítico como el que se está dando en Zambia, en el que hay una mortalidad infantil y maternal altísima. Y cómo a través de la música están apostando tanto el gobierno de Zambia como el gobierno británico, con quien están colaborando, con quien son partners, para hacer frente a esta situación. Y cómo se han adaptado desde hace 2 años que comenzaron este proyecto hasta la situación actual en la que siguen trabajando frente al coronavirus. Antes de empezar con James la conversación, os voy a contar un poquito sobre él. James es investigador social y educativo del Centro para la Investigación Educativa y Social de la Universidad de Huddersfield. Huddersfield es una ciudad universitaria que está en el norte de Inglaterra, entre Manchester y Leeds. Toda su carrera la ha centrado en la investigación social y sanitaria en torno a la familia, a la infancia y a la maternidad, y trabajando incluso para UNICEF en Asia Central. Y bueno, la investigación de la que nos va a hablar hoy recibe apoyo y financiación por el gobierno británico, por el Consejo Británico de Artes y Humanidades, y tiene una colaboración con la Universidad de Sheffield y con St. John en Zambia. Y bueno, esperamos que sea muy inspirador, tanto para personas que están interesadas en el impacto que pueda tener la música, como para todos aquellos que trabajan en entornos clínicos o de innovación social. Hello, James. Thank you very much for to
Hello.
answer to our invitation for this afternoon about music and science and the impact of music and songs in maternal health. So we wanted to ask you, what's the situation in Zambia and why lullabies to address such a critical situation?
So maternal healthcare in Zambia is at a critical point. In May 2019, President Lungu declared a public health emergency in maternal and child health. 790 women had lost their lives through maternity-related reasons in the previous year. Zambia, in many ways, has been a success story in relation to maternal and child health. They have reduced the number of deaths of both mothers and infants for years. But that progress has stalled, it's stopped. And there are lots and lots and lots of different reasons for that. Some of them have got to do with age, geography, distance that women have to travel to clinics, education. But it's an impoverished health system. So as a comparison, Zambia spends approximately $56, $57 per head of population on healthcare. In Spain, the spend is about $2,400 per person. In the Euro area, it's $3,500 per person. In the UK, it's almost $4,000 per person. And that's even before you take into account wider welfare expenditure. Mm-hmm. So President Lungu declared a public health emergency and asked for innovative interventions. And at the time, I became particularly interested in the Finnish baby box. Mm-hmm. And because it was gaining a lot of media coverage, both in the UK and the US, and I'm a social scientist, I'm not a clinical scientist. Mm-hmm. And I was interested in the baby box and its materiality, for example, and the stuff that came with it. So I started to think about how objects had an impact on health and maternal and child health. So through some connections with Zambia, we started to have a conversation. Now, at the outset, I need to say that it was clear to us that baby box would not be an appropriate intervention in Zambia. Mm-hmm. But it was an interesting starting point to develop a conversation. Mm-hmm. With some colleagues in Zambia, we had a number of workshops where we introduced this concept of the baby box to local healthcare practitioners and to local women. Mm-hmm. Who loved the idea of having stuff, and I think who doesn't like the idea of having stuff? I mean, in Finland, the 98% of women who take the baby box love the fact that it comes with hundreds of euros worth of stuff. In the UK, all the evidence shows that women who use the boxes love the stuff that comes in it. So who doesn't like the stuff? But in contrast, they were also horrified at this material object, because to them it looked like a child's coffin. This is incredible. Yes. A simple cardboard box, and we bury our children in boxes.
This is incredible. How cultural boundaries.
Absolutely. So that reinforced for us that these sort of very Western, very expensive objects just simply wouldn't work. So our approach came about really on a foundation of sustainability. How do you make an intervention sustainable? So if you start to think about sustainability, you need to think about a number of things. You need to think about economics. So maternity packages like the baby box simply are not economically viable. They do not and will not work. Exactly. All of the progress that Zambia has made in recent years in reducing its maternal and infant mortality have been based on significant help from overseas donors. What happens if the UN leaves? What happens if US aid leaves? What happens if UK aid leaves? What happens if all of that money goes and Zambia is left to cope on its own? It's a disaster in the making. It's those models, however helpful, however positive, however much they achieve, simply are unsustainable. Another key aspect, of course, sustainability is culture. You can't ignore culture and what people do, how they live their lives, what's important for them, and indeed what their cultural capital is, what their talents are. So how do you work iteratively with people? how do you work from people's experience? How do you understand their culture? How do you understand their social networks? And how do you empower them to come up with ideas about what might work that is sustainable? Now, in the context of Zambia, I come back to the economics. Sustainable means free. And I'll explain the process that we came to in relation to that. As I said, we started with an object that we knew wasn't appropriate and wouldn't work, but we wanted to understand the dynamic. So we started with the baby box. We weren't ever going to suggest that was what we would use, that type
Can
of
imagine.
It was just.
However, we are fascinated about two things. First, such a deep exploration and research and understanding process to come up with the proper methodology, because it's very different just to give and to offer maternity packages up to the idea of singing and more arts and humanities strategy. And second, I'm fascinated about how the country and how the government really bets for applying such an innovative way of intervening that problem.
So if I can start with your second question first. St. John, as I said, are a key partner in the programme, and they offer support to the nurses and to midwives in clinical settings with the support of the Ministry of Health. And the Ministry of Health have representatives on the St. John board in Zambia. So whilst we're working directly with St. John, we are working indirectly with the support of the Ministry of Health. Mm-hmm. Now the ministry obviously also work with the UN, with UNICEF, and with large donors, but they're also acutely aware of the importance of taking into account cultural practices. Yeah. How we got to this innovative approach was in workshops with local women, with local practitioners, and with mothers. So we visited Zambia with St. John, and we had a workshop around the baby boxes. So we got to the point where we all understood that baby boxes would not be appropriate. So the obvious question then becomes, okay, so what might be appropriate? And our next iteration in this journey of discovery was thoughts around a chitenge. A chitenge is the ubiquitous wrap. It's a garment, a huge piece of cloth that's worn by women all over the world. It's not uniquely African. And the women who attended the workshops were wearing these garments. And some of the garments were printed with political slogans. They were also deeply colorful and obviously cultural and regional. So we started to think about how chitenges might work, and we came up with 3 designs. We started a competition with students in the UK to come up with 3 designs for chitenges. One was around safe spaces in Lusaka in Zambia for young women who are mothers who are living on the streets. One was around how to prevent malaria. And another one was around safe messages and safe aspects of infant care. And they were very well received as an idea because they're culturally specific, colorful, they recognize people's regional allegiances, they were pictorial. I mean, depending on the statistics that you look at, up to 35% of women in Zambia can't read or write. So there's no point producing printed material. There's also no point in producing printed materials because one of the things that we discovered was I might produce a very nice list of stuff, of information, but if a clinic doesn't have the paper on which to print this information and doesn't have the ink on which to print this, then there's no point. So
Yes.
Ubiquitous everyday wear was an idea. But when we started to look at that more deeply, you know, how do you, so sustainability, how do you then scale that up? How does that become part of every day? Well, where would it be produced? Who would print them? Well, the likelihood is that they would be printed outside of Zambia, in China or Bangladesh. That's a problem.
Yes. Mm-hmm.
Because that's not sustainable.
Mm-hmm.
And also, how do you pay for that?
Exactly.
That's a problem,
mm-hmm.
because that's not sustainable. So as part of this discovery process with the local women, the next inevitable question was, okay, so if we can't have baby boxes and if we can't have chitenges, what are your childcare practices? What do you do? And they sang. And I remember being in that workshop in Lusaka, and it's an often used phrase, but literally the hairs stood up on the back of my. I've got little hair, so what hair I had, and stood up on the back of my neck. The women sang, and they sang traditional songs about how to reassure a child to sleep. They sang songs as a grandmother to a child because the mother was out working in agriculture, or was outside working in the fields, to reassure the child that the mother was going to return. And they sang beautifully. And we began to think and to talk a little bit more about song, and they sing in local communities and churches, and it is a common experience. Singing is what these people do every day, and that's how we started to think about song and lullaby.
So you actually convey an educational message within the songs, and people working at hospitals and midwiferys are who sang those songs, and they teach them to women and pregnant women. But so it's actually the message you put in the songs. It
is. So there's a couple of things. It's a couple of different types of message. So as you mentioned, singing is culturally specific. So every morning as the clinic opens, the maternal and child health volunteers will go outside and sing songs as a welcome to the women. So there's the breaking down of barriers, there's cultural recognition, it's women engaging with other women, it overcomes some of the potential barriers of going into those sort of clinical sites. It's a wonderfully warm welcome. But when we started working with the volunteers, we began to help them think about the types of messages that were important to convey. And there were a couple of obvious ones that they came up with. So one was based on the days of the week. So the clinics open Monday through Friday to Saturday sometimes, and different things happen on different days within the clinic. So they came up with a simple song that said, on Monday we do, on Tuesday we do, on Wednesday we do. So the women absolutely understood what day of the week they could come for what support. There are also issues around breastfeeding, for example, and nutrition. So some of the songs had messages around breastfeeding. But the songs were also used to dispel certain myths. So, for example, swelling of the hands or the ankles and headaches. So, and what the women would also do is not only sing them, but there would be actions within the songs. They are performed. But to explain actually that they would dispel misconceptions about swelling and about headaches, but also point out that actually that means you should come and see a clinician. Also in relation to children's care, they would dispel myths, but say then it's important to come and see a clinician. Or because they're volunteers working in the local community, local women can phone them or contact them. They know who they are, they know where they are, and they can receive a home visit, for example, from the volunteers. So it's starting to percolate really important clinical information, but also to dispel some potentially harmful information. So I'm not arguing that the songs reach 100% of women, but what I'm arguing is that the approach that we have adopted is context specific and is a foundation from which to build trust that can reach many, many women, and perhaps more women than a system that's based only in a clinical setting. Part of the work is about interrupting the normal clinical process in the sense that you move away from the clinic. Singing happens in the clinic also, but it moves out of the clinic into the local community. And the songs are being done by women who are local women. You know, they are from within that community. They are not outsiders who simply visit that community and who leave. I think it's also important to think about actually what we can also learn in the West. We started this conversation by thinking about baby boxes or talking about baby boxes. Now, don't get me wrong, I think baby boxes are fantastic. Okay? But they're fantastic in Finland. They're fantastic in places that can afford them. What else might we be able to do in the global north that we can learn from the global south about frugal and zero cost interventions? What might we be able to do with particular communities, vulnerable communities, hard to reach communities in the global north through song? And I think that needs to be thought about, and that needs to be tested, and that's a step that we intend to take in the future.
Yeah, I think that's something that, for example, the World Health Organization has recently launched a call for health systems to make use of arts and humanities. I think Western societies are really conquered as well by material solutions. And yeah, one thing probably is the lack of empirical and the lack of research that really show how efficient these kinds of strategies are. So yeah, we have to work towards that, but I think yours is a bright example for Western societies to copy or to inspire.
I think absolutely. I think we need to be open to learning and to the expertise and knowledge that is within sub-Saharan Africa. These are very, very complex peoples who have done wonderful work with few resources for years and years and years. I'm not even going to get into the difficulties of colonization and the legacy that's left behind. But they are the most, in my experience, gregarious people who are open and willing to share their knowledge and understanding. And it would be a travesty if we in the global north weren't open to that.
What kinds of implications the work you are doing may have in a very short term for other organizations or for governments themselves?
Again, it's very early on to make any concrete judgments or findings about our work, but I think the COVID-19, sorry, to take a left turn slightly, but it's topical. But I think the arrival of COVID-19 in Zambia has offered us an opportunity to demonstrate how frugal design, frugal intervention, how song can make an impact. I think in responding to a pandemic or an epidemic or any health emergency, the ability to be able to respond quickly and to scale and cheaply is a lesson for us all.
Music has been really useful, I think, around the world, all over the world now, in this coronavirus crisis. Since we have been able to listen to a lot of songs, specific songs for the better hand wash method, and since the beginning. So it seems that music is a very efficient and, as you say, cost-effective tool for a situation of emergency.
But it's also familiar. Mm-hmm. It's familiar. It's what people do. It's what people do if there's, be it that they are mothers and singing to their children to try to get their children to sleep or to try to reassure them. It's what they do in local churches. It's what they do when they come together. It's what people do at football matches. It's what.
Yes, exactly.
It is universal.
Exactly. So thank you very much, James. It's been a pleasure to have you, and I hope this may serve and inspire both people working in social action, in clinical settings, and as well as institutions and organizations that want to apply arts and humanities strategies.
Thank you. Thank you for the opportunity. As a sign off, I think what I would say is that we're not suggesting that our approach is perfect. It's not. It's not perfect. It doesn't do everything. It is an imperfect approach. Mm-hmm. But it's an imperfect approach that works, which is better than a perfect approach that doesn't. So I'll leave everyone with that thought.
It's an approach that is looking for adapt to the situation and to give the best. Yes. Thank you very much, James.
Thank you, Maria.